The new prescription change made to Medicare has not gone very well. Could you highlight the problems and what action you will take to remedy the problem?
The prescription drug program that was voted in before I got there, but that has been in effect, put into effect this last year, actually has gone far, far better than most people suggested. Those who opposed it said, number one, you'd never have enough companies out there cooperating with the program and presenting opportunities for senior citizens. That was the first suggestion and complaint. The fact of the matter is we had so many companies around the country that people said it was confusing for senior citizens. There was too much choice out there. Secondly, they said there wasn't enough information given out so that seniors could make a reasoned judgment. Well, they accelerated that, and we found out that we had tremendous sign-up rates of senior citizens around the country. Thirdly, we have seen that there's actually been a savings, considerable savings on prescription drugs for senior citizens under the program. The thing that is troublesome at the beginning and continues to be troublesome is the overall cost of this program to the federal taxpayer. But you have to analyze it and say this. When Medicare was first established, it was established at a time when medication, prescription medication, was not as central to the care of patients as it is today, particularly senior citizens. And basically, we paid for other kinds of things, including surgical procedures, hospital stays, but not for medications. The idea was to try and transform the system, bring it up to more modern times so that it was more in keeping with the practice of medicine at the present time. Again, I was not on record on that because I wasn't in the Congress at the time, but the fact of the matter is the complaints that people largely had in anticipation of the program have not proven out. And the cost of the program has proven to be considerably less than people anticipated, although it is still a major cost to all of us as federal taxpayers.
The Medicare Part D bill is not so much a benefit for seniors as a benefit for the drug companies. It was written by and for the drug company lobby. Probably one of the greatest examples of that is one of the congressmen who helped usher it through, Congressman Towser from Louisiana. After the bill got through, he retired from Congress and took a job with the pharmaceutical industry at an enormous salary. The Medicare Part D prescription bill specifically prohibits the government from using its purchasing power to leverage down prescription drug costs. That makes no sense if government is of, by, and for the people. It makes all kinds of sense if government is of, by, and for special interests. And again, this is a great example of the failure of the government to represent the interests of the people. The cost of the prescription drug bill far exceeds what was predicted. The people who voted for it, the congressmen who voted for it, felt that they had been duped when they came back to them and said, oh, this is the actual cost. They said, no, that's not what we signed up for. We signed up for something less. It was totally bewildering to seniors how to sign up for it. The reason there was this spark in sign up was that there was a penalty. If you didn't sign up by mid-May, there would be a penalty to you for the rest of your life if you then later signed up for the program. There's this crazy donut hole where between $2,250 and $5,000 of drug expenses, you get no coverage whatsoever, even though you continue to pay premiums. On top of that, instead of a nice, simple system, there are now 47 private insurance companies interposed between the providers and the government in this Medicare Part D bill. It's a disaster.
More than 38 million seniors have signed up for it and are saving an average of $1,100 per year. That doesn't sound like a disaster to me. Seniors with limited income are paying little or nothing for their medications because they, under the system, don't have to pay virtually anything. Competition is reducing costs. The average monthly premiums are $24, down 40% from the original estimates. They expect the average premiums to remain at $24 or drop. The estimated cost to the taxpayers has dropped by $259 billion. A recent J.D. Power survey reports that of the more than 3,400 beneficiaries certified, 45% said they're delighted with the coverage. The vast majority said they're happy with their coverage. I mean, that doesn't sound like a disaster to me. And I don't know, but I don't believe as many as conspiracies as you do, sir. Maybe people disagree with you because they have a difference of opinion, not because they're involved in some grand conspiracy.
Again, the cost of the Medicare Part D bill far exceeded what the estimates were when Congressmen paid for it. Some seniors, in fact, the majority of seniors who enrolled for it are paying less than they were before, but that is a boondoggle to the pharmaceutical industry, and as a population, we are paying a whole lot more than we should be paying for prescription drug costs. Some 20% or so are actually, of seniors are actually paying more under the Medicare Part D than they were paying before. We need a true prescription drug benefit, and we need to use the government purchasing power to leverage down healthcare costs, healthcare costs and prescription drug costs, so we can get the same good deal that the people do in Canada, where their government represents them and not the pharmaceutical industry.